Good afternoon. Today's Friday, February 2nd, 2024, and I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Thank you for joining us. Monday night was our monthly call board meeting. Excited to have Pastor Chris Wigley from Trinity Baptist Church here in town started off our board meeting for prayer. It was a great opportunity for the board to meet him. It was also, after he gave his prayer, he updated the board on an event that's coming up next weekend, the Night to Shine at Trinity Baptist. It is a prom for our special needs adults and teenagers in the Mount Pleasant and the surrounding area. So it was a great presentation by the pastor. If you have any friends or family of special needs, check out Trinity's Facebook and their website. They've got the information. It's part of the Tim Tebow Foundation of Night to Shine. But it's a great event. We're excited that TRMC is going to be able to volunteer and assist in this project, and our EMS will be on site. But the pastor did a great prayer, and we were excited about that. On Monday night, we did update the board. Dr. Connor, our neurologist and leader of our stroke program here at Titus, joined the board to talk about our Joint Commission survey we had in December. It was the day before Christmas. I think I talked about it in the last community update. But we are surveyed on an annual basis, every couple years, on our stroke program by the Joint Commission, and it was a phenomenal survey. Dr. Kahn came to the board and talked to him about a few of the fine things that we're doing, and some exciting news that he announced Tuesday, that a paper that has been written in a study of patients and stroke program that's going on here at Titus is being written up and presented to the International Stroke Conference next week. So the emergency department is here in the picture, along with Martina, our stroke coordinator at Titus, who works closely with Dr. Kahn, made the announcement this week at the board meeting, and then the next day as well, that they had been selected for that paper to be reviewed at the International Stroke Conference. Huge accomplishment for our team. First paper that's been written, and the technology and the protocols and the science that Dr. Kahn and the team have brought to Mount Pleasant, Northeast Texas, is phenomenal. We're leading the nation in some of the work that's going on in stroke. So we're excited, and congratulations to all the team members that are part of the stroke team and this accomplishment. Also this week, I was getting my infusion on Wednesday. Me and Angela were walking out, and it was, a tough morning, and it was fun to walk out, and I saw all these kids outside the cancer center at Titus, and they were putting rocks. So our thanks to the Chapel Hill Elementary and the arts program at Chapel Hill, and the teachers and the PTO, creating a rock garden outside of the cancer center with special messages on these rocks. So when me and Angela walked out, we got to see all these children just putting out these rocks and laughing, and I heard several times, "Oh, here's the one I did, here's the one I did." So it was exciting. So from our hearts and from as a patient of the Cancer Center as well, thank you for me and Angela to that group at Chapel Hill for the rock garden. It's fun to see when we walk up. I also like to congratulate the Mount Pleasant Tribune Reader's Choice Awards came out this week, and Mount Family Care Center Mount Pleasant was chosen as the best clinic. So I wanted to give a shout out to the team over at the Family Care Center Mount Pleasant on the south side of town, Dr. Burrow, Dr. DeLisi, and the team, Andrew, Cheryl, and everybody who works at that team. Just great work. We've been there since 2014. It's been great work, and to be recognized by the community for those efforts was a huge accomplishment for them. So thank you for the people who recommended them and voted for them, and congratulations to everybody there for their service to our community. We're excited and so grateful. This year we launched in January our orthopedic new website. Please go to TitusOrthopedics.com. Dr. Hester, Dr. Pappas, Jacob do a great job in our orthopedic center at Titus, and this website just gets more information of who they are, what they do, a lot of health information, some things to check out, the procedures they do and the opportunities. Podiatry is also on there as well. But thanks to the team, Bobby Moore, Tiffany, and all the team that was involved in putting this together. It was huge effort to get this new website, but excited for that. An opportunity for you to learn more about the patients and the resources available at the Orthopedic Center. So January was busy, a lot of great things happened. We got a lot of things happening in February as well. February is going to be a busy month. I want to let you know of Lunch and Learn on February 14th, Valentine's. So don't forget, wear red. Make sure you get your sweets, some chocolate or flowers that day. But we will have our monthly Lunch and Learn. Excited to have Dr. Sekulich, Dr. Downey, and Dr. Siegel speak on heart screenings and lung screenings. There's a lot of emphasis and a lot of things of work that we can do and preventive work that we can do to improve the health outcomes in Northeast Texas. And excited to hear their presentation. They are doing some phenomenal work, and it'll be a very good showcase that day of the screenings that are now available for both cardiac and lung. So look forward to that presentation. We encourage you to come out on Wednesday the 14th at 12 o'clock when the presentation starts. Get there 11:30, get a good seat. We also have my favorite thing to say of all the things we do all year. The following Saturday, we have our React Quicker, Save Your Ticker Health Fair on February 17th from 8 to 11. We have it in the TRMC Mall lobby. Health Fair is focused on, as Cardiology Month is February, focused on a lot of cardiology activities. However, this is the time of the year that we have our reduced labs, lipid panels, A1Cs, PSAs. It's a great opportunity at a low cash price if you do not have insurance or have high deductibles to get this done on Saturday from 8 to 11. Join us. We'll be there and be glad to see you that morning. I want to thank everybody for all the prayers and well wishes as we go through this journey, Angela and me, with colon cancer. We are posting on Facebook, and we're also posting on the Cancer Care at Titus Facebook and webpage as well. Some posts along the journey, some things that we've learned together. A lot of thank yous to a lot of people who've helped. Medical staff's been great, but please reach out to that. You can follow along. We post every couple of weeks some things going on that one, but really trying to educate on colon cancer and also educate on the services that are available at the Cancer Care Center at Titus. Dr. Singh and Dr. Vo have done a great job. It has just been a blessing to me and this community of the work they've done. As you know, in January, had a little snow, had a little ice. Want to thank our COO and CAO and friend, Patty Beckman, for this picture that she texted us on that morning, but of the Titus campus with snow. But want to say a thanks to everyone involved. We stayed open, and the hospital stayed open, and the surgeries kept happening. On Monday, when a lot of roads were shutting down, we had people who needed surgery, and those surgeries happened. And want to thank all the staff who came in and drove people around, picked people up who couldn't drive in the ice, and also our government officials who helped us as well, make sure everything stayed open, and our facilities teams and security teams. A lot of work by a lot of people, but beautiful day there and to see the ice and the snow. But thanks to everyone involved by just being able to keep the hospital open and keep the community serving while many others are shutting down all around us. I also want to give a shout out to our EMS team. Jamie and his crew, the Friday before, were able to get a grant from our regional emergency center, purchase, I think, almost 50 heaters. And we started Thursday afternoon and Friday afternoon handing them out, went to several churches, and they worked with us to get those out to people who need them. With that cold weather coming in the low 1s and 2s and 3s, getting these heaters across town. Rigoberto and the team were out at the Ignite Health Fair, and we're able to give out a few of the heaters there as well. But thanks to everybody who helped with that and getting those heaters out there. So with January, what does that mean? New Year's resolutions and losing weight and going through that process. I want to give a shout out to the Titus Fit Wellness Center. They're doing their Pounds Down Challenge. We filled up with all the participants really quick. If you want to keep an eye on what's going on, go to the Titus Fit Wellness Center Facebook. Follow along. The leaderboard is up there. You also follow tips and challenges and information that how you personally can lose weight this year from that one. So it's one of those things I know we're always working on, but thanks to everybody at the Wellness Center for doing this on an annual basis and helping our community get in better health from there. So had the opportunity yesterday, Chief McCrae hosted the Mount Pleasant emergency response. We're getting prepared. If you've not heard about it, it is upcoming, but on April 8th, 2024, there will be a solar eclipse in this area. As you can see by the picture up there, and the red dot is us. Sulphur Springs is going to be right. It was one of the best places in the world to watch it. But there'll be a lot of traffic, and there's going to be a lot of people here in Mount Pleasant coming from out of town. My understanding is hotels are already full for that weekend, but a lot of people coming from the area. So wanted the community to know that we're already preparing for it. The city, the county, and surrounding, the hospital as well, and EMS are working together to make we're prepared for that weekend, and we're prepared for all the visitors that will come here. But put that on your calendar if you're getting special things going on that weekend. You may want to rethink your calendar that weekend, but it's going to be exciting to watch that, and Mount Pleasant's going to be a great place to watch the solar eclipse. It's that time of the year, and with Mardi Gras coming up in the next few weeks, it's going to be our theme this year for our gala. We're doing our Go Titus Gala, our grand gala, the last Saturday in April is when we do it, April 27th, 2024. Truly appreciate the museum for allowing us to host it out at the airport again this year. Had a great time last year, and I can only imagine with the Mardi Gras theme and those colors, what costume my wife's going to have for me. But we encourage you to join. Go to the Titus Regional Foundation Facebook, and you can get the forms to sign up for tables and sponsors. We'll be sending all those out this weekend. But we're ready for a good time. We've got David Whiteman coming back to town, who's always a hit, and we enjoy having David here. So look forward to that. But our funds this year are going to go to investing in some upgrades in the cancer center and really investing in our cancer care program. So we're excited about that, to have that as part of that. So go Titus Gala, get that on your to-do list, get that on your things to get ready for us. But I'm excited, looking forward to it. So finally today, I would like to address the latest press release and rumors surrounding Christus coming to Mount Pleasant. Their announcement was not a surprise to us, as we've met regularly with their regional CEO, their president, and their leadership over the last 5 years. We've appreciated working directly with many of their physicians, and in fact, almost all of our cardiology referrals for open heart surgery and other cardiovascular procedures that we do not provide here locally have gone to Christus Mother Frances Heart Hospital. They also receive many calls for transfers of patients for other complex services that TRMC does not provide. Last year, the tone of our discussions with Christus Mother Frances leadership changed significantly, as they informed us in November that if we did not agree to sell the hospital to them and become part of the Christus system, they would be coming to Mount Pleasant. Based on their recent press release, this is what they intend to do with a freestanding emergency department in Mount Pleasant. The Titus County Hospital District Board and myself are very disappointed in the predatory strategy this faith-based health system has chosen as their opportunity to expand business in our community. The one-up, exit-up freestanding emergency department model is detrimental to a rural community and a rural independent hospital. The TCHD board and I have made it clear to Christus there are many ways for us to partner and collaborate with them. However, TRMC is not interested in giving up local decision-making and local control of TRMC's health strategy for our community. This local decision-making authority was critical in life-saving COVID. The outcomes speak for themselves. This local decision-making was critical in the decisions for us to deliver 900-plus babies in our health system, as more than 2/3 of rural hospitals in Texas have closed maternal units. The local decision-making is critical in our decisions surrounding our national recognized programs, like the stroke I just mentioned, our cardiology program, our cath lab, our EMS, our ICU, our oncology service line, our primary care, and the growth and expansion of our phenomenal orthopedic program. This is evident of our commitment to continue to grow and serve our community. We are working with the City of Mount Pleasant and beginning our phase 3 of the process to construct our 60,000 square foot ambulatory specialty center on the north side of the hospital that has been in the works since COVID. As for rumors, Christus is trying to purchase TRMC. Christus and several other health systems have been trying to purchase TRMC for several years and regularly check in on us and our current interest. As for the rumors TRMC is near agreement on a purchase by Christus or any other health system, that is totally false, and no agreement from any system is being reviewed by the Titus County Hospital District Board. Christus met with one of our Mount Pleasant pastors in the last few weeks while in town. While I was actually having an infusion, he texted me, and Christus told our pastor that 70% of the hospitalizations from Titus do not go to Christus, and they were coming to Mount Pleasant to ensure they maintained their share of our region. As Christus is called for many transfers unless the patient in the community directs the transfer elsewhere, this new proposal is an attempt to take away from our community the opportunity by contributing to TRMC not having us be here to ensure you have a choice. Given the outstanding physicians we have in our community, along with the many awarded quality programs, such as stroke program, these awards are typically not evident in many rural corporate health systems across Texas. TRMC is ready to compete with any health system wanting to move into our area. However, this corporate mentality and strategy is detrimental to the focus of TRMC, which is community health care, not corporate health care, and is damaging to local health outcomes. TRMC is committed, and as you can tell by the first part of the community update, we are focused on you and our community. in an effort to really talk about the landscape of healthcare in Northeast Texas, we are planning a community town hall on February 22nd. And I'd like all of our Titus County and 4 surrounding members, come join us. It starts at 5:30 at the Mount Pleasant Civic Center. We'll talk about, what's going on in the landscape and what's changing within healthcare, and talk about what Titus has to offer and what Titus has done in the community and where we're going over the next 1, 2, 3, 10, 15 years. We're proud of our independence, and we're proud that the ability that we are able to make local decisions and work with everyone here locally on a daily basis. Thank you for the opportunity that you've given us to serve you. Thank you for the support that you've given to support Titus, our physicians, and our team members on a daily basis. On behalf of the board and the behalf of the team at Titus, we thank you for your support, and God bless.